Mariam Matar, founder and chairperson of the UAE Genetic Diseases Association, Dr. Graciela Morales, Vice President and Vaccines Lead for Emerging Markets at Pfizer, and Dr. Fadi El-Jardali, Professor of Health Policy and Systems at the American University of Beirut. I am most appreciative to all our distinguished guest speakers, and importantly to Dr. Wala El-Alami, our valued board member, Vice President Cluster Lead at Pfizer, for moderating today's webinar session. Pfizer is a valued global partner of the Arab International Women's Forum. We're also honored to welcome today valued participants who have joined us from across the world, close to 250 registered participants from 30 countries. The duration of the session is 60 minutes. Following the introduction, I shall invite Dr. Al-Alami to deliver her remarks and launch the discussion with our distinguished panelists, which will be followed by Q&A. I urge you to submit your questions during the webinar. Distinguished guests, in these unprecedented times in which the international community is greatly preoccupied with managing the spread of coronavirus and with economic recovery efforts beyond COVID, the Arab International Women's Forum takes a moment to acknowledge the women at the front line of the coronavirus crisis. Women in science, research, policy development, healthcare, the media, and women who are caregivers, mothers, and community leaders. Indeed, women's roles now are more important now than ever. Women are truly spearheading the fight against COVID-19 on multiple levels, as doctors, medical researchers, epidemiologists, parliamentarians, and ministers, all while facing disproportionate social, economic, and health risks. This is not to discount the valuable work of men. However, it is an opportunity to give women the visibility and the attention they have rightly earned as leaders. We express our sincere gratitude and admiration to them all and to all health worker professionals and all those keeping essential services running all over the world. The coronavirus pandemic has presented the most serious global public health crisis of our time, and the impact will be felt for many years to come, not only in the field of health, but also in the economy, in job creation, and in civil protections. It is the collective responsibility of us all to stand together to overcome the lasting challenges that this virus will leave in its wake. Looking beyond COVID-19, the board of the Arab International Women's Forum and I pledge our full support to our partners in the international development and business communities to ensure that all women across the globe retain their vital voices in efforts to restore and to renew our communities, our societies, and our economies. I thank you all for your kind attention, and it gives me great pleasure now to invite our moderator, Dr. Wala El-Alami, to deliver her remarks. Wala, over to you.
Topic nowadays. Good afternoon, all participants. Good afternoon, dear panelists. I'm very much looking forward to what I know will be a great discussion. Just to pave the way to the discussion and building on what Mrs. Haifa said. Indeed, Haifa, you mentioned it, the COVID pandemic actually is far more than a health crisis. We have seen it, and we will hear it more from the panelists. It's having a very strong socioeconomic impact across the globe. And while the impact, we know it, is varying, and we've seen it in the responses, but we've seen it also in the impact. It varies from country to country. All the early simulations of the impact, be it at a societal level, at an economic level, so that we will have an increased poverty and an increase in inequality. And when we see this being built on pre-pandemic inequalities, we realize the magnitude of the challenges that we will be facing post-pandemic. Coming to the topic of today, and you've rightfully mentioned it, I think there are a couple of data points that we need to keep in mind to realize the role that women played during this pandemic. All the reports show at the global level, it's very true in the MENA world as well, women count for 70% of the health services. And you have rightfully mentioned it, Haifa, we've seen them in the forefront dealing with COVID, sacrificing their time, and sometimes, unfortunately, their lives to support all the patients and their families during this crisis. When we add to that all reports in previous crises have shown the increase that we see in gender-based violences. When we add to that the gap of wages that is well known between men and female in strategic roles that have been in the forefront of the pandemic. In average, as many of you know, women make 80% of what men earn doing the same job. We really realize that when we look forward to the post-pandemic recovery plan and also the pandemic future plan, because we want to be prepared and learn from the lessons of this pandemic on how to address the challenges moving forward, we realize that this problem needs to be looked at as well through a gender lens. And I think we will have the opportunity to discuss this at length with our speakers. And the last point that I wanted to make is we spoke about inequalities, gender-based, but we also need to keep in mind the magnitude of, the challenges that are generated from the pandemic and the importance that we see public, private, civil societies coming together and joining forces to address and put in place the recovery path, but also think forward, on the lesson learned from the pandemic to address some of the gaps that we might have uncovered from the pandemic. And I'm very much excited today to have the speakers with us, Dr. Fadi, who will be, helping us to get a sense of, the socioeconomic impact that we've seen from COVID. We will be talking with Dr. Mariam as well on her perspective on the lesson learned from UAE and the Arab world on how to manage the pandemic. And we're also very much looking forward to discussing the topic on public-private partnership with Dr. Graciela representing a key sector in the fight against COVID and trying to find the vaccine and treatment that should help us end the crisis that we're going through. So these are, the remarks that I wanted to kick off the discussion with, and I think we can get started with you, Dr. Fadi, with your experience and what you've seen happening across the globe. What are the main socioeconomic impact that we have seen citizens, especially women and youth, suffering from during the COVID crisis?
Thank you so much. Thank you for having me on the webinar. It's a pleasure to join the group. So let me start by saying that, as you know, that the world is really witnessing the worst public health crisis. And I would say since 1918, we haven't had really that type of a pandemic that actually really affecting the whole population globally. And one thing I want to mention that, one of the things that we're starting to learn from this pandemic, that in fact, many countries have made the wrong political choice by not investing in public health infrastructure and public health preparedness. And this is why we see that even many of the scientifically advanced societies were not able, in fact, to protect. In fact, some of them failed to protect their population as a result of the pandemic. We've seen some societies were not able to prioritize some services that need to be provided to vulnerable population, including, and this is one that we talk later on about the gender issues, but there are a lot of vulnerable population, including youth, including women, including healthcare workers, including refugees, etc. We've seen that, in fact, many countries that were really not a robust social policy system that they have in order to provide social protection and economic protection at the time of crisis. So what I'm trying to say is that there's a lot of elements that we need to start building on to see if we want to talk about the social economic impact of this pandemic. We need to really reflect on what we have learned so far. And I have to tell you that even globally, there's now hopefully an engaged discussion and conversation about what countries can do to be better prepared, whether for wave 2 or for a future pandemic. I see this pandemic creating a major political and social issues in countries. But this should not be a missed opportunity, because this is where we need to build on some of the more of elements of hope when it comes to change in political and social system, when it comes to really how we can protect the population. Now, to go to your question, certainly, and before I go there, you mentioned something about equity and equality and all this. And I tell you, and I think we have a robust evidence now, that equity and social inequality matters. Equity and social inequality really matters a lot, and actually it will hurt us. Inequity issue will hurt us all equally, regardless of where we live and regardless of our income level, of our education. I think the pandemic proved it very clearly. The question is how much countries now are changing their political, social, economic policies in order to really to reflect on the issues about equity. Over the last many years, there has been a lot of advancements on the global agenda when it comes to equity in terms of the role of women, etc., vulnerable population. I'm hoping that this, what we are seeing now, will not eradicate much of the progress that has happened about the equity agenda, but more importantly, to build on that, to move it forward. The last point I want to mention about the economic, and so I think there is a documented evidence that most countries have been really hurt very hard economically. And I think that's why there is a lot of discussion about the trade-off between health and wealth, meaning, how we can make sure that we revive the economy but not affecting the health of the population. I think that's a tough decision. It's a trade-off. That's why many countries were not consistent in the relaxing the measure when it comes to the lockdown. Not to say even there was significant variation of how countries responded to the pandemic itself. So we have a major economic more of implications. And if you look at the evidence, a lot of documentation about, particularly in the Arab world, and particularly in the countries that are really fragile and low-income countries in the Arab world. The major economic implication when it comes to GDP, when it comes to unemployment, and unemployment particularly in the youth sector, and in the informal sector, which is also very critical. The issue about the social implication, and we'll talk later on about some of the issues related to gender and all this, but we've seen that many countries were not prepared. They didn't have a social protection schemes that can be deployed immediately at the level of emergency. So there's a lot of evidence. I'm not going to go just for the sake of time, but I tell you that we have a lot of evidence related to that. Even when it comes to unemployment rate, the expected now, we might have around 1.7 million people unemployed, or they lost their job as a result only of coronavirus. So you can see what would be the implication for the future. I know that some countries, particularly all Gulf countries, are really more having putting some economic measures in place when it comes to, for example, of course, UAE, Qatar, Saudi Arabia, etc. But still the impact on the society is really larger than what we're seeing now in terms of the economic stimulus. We have an impact on issues related to healthcare workers, domestic violence. It's a huge issue. We've seen a significant rise when it comes to domestic violence, particularly targeting women and youth at the time of coronavirus. We're seeing issues related to food accessibility, to availability, among other elements when it comes to this. So social assistance and social protection schemes were not ready in many of the countries that were hit as a result of coronavirus, particularly in our region. The last point I want to mention, we still lack regional solidarity. One of the things that we really, although I tell you that even at the global level, if you realize yesterday, United States officially withdrew from the World Health Organization at the time where we need global solidarity and we need to strengthen the role of the World Health Organization. But we're not seeing also regional solidarity. We're not seeing regional cooperation and coordination and synergies among all countries, and this worries me because we are still in the middle of the battle. We haven't really finished from coronavirus, and the expectation, if we see that wave 2 and wave 3, if you look at the history, that might be even much more tougher and harsher than in terms of implication than wave 1. So these things that we need to reflect on it. The implication of health system, I'm happy to speak about it later on because I think it's important also to talk about health system resilience, and we can discuss it also as part of this video.
Thank you very much, Dr. Fadi. That was extremely, spot on. I think you have covered very comprehensively all the areas that the pandemic have, uncovered. And I think one of the key points that you have mentioned is, and you are right, we can come back to it after hearing from all the panelists, is what are the lessons learned, from this pandemic. It's not the first crisis. It's not the first economic crisis that the world is going through, right? So we had several crises, across the history, but this is the first one that includes multiple dimensions. And you are right that, for governments, for societies, we will need to see quickly the lessons learned to integrate them in the plan because we are just in the middle of it. We've seen many countries going to wave 2, and I think there is a big hope that being caught by kind of surprise, if I may say, with wave 1 of the crisis and having digested and learned a lot from wave 1 gives us the opportunity to pause as societies and see what can we learn and what have we learned to really address wave 2 differently. And absolutely, this is definitely something that I appreciate in your talk. And you have also mentioned a very important point, which is regional solidarity, but also the variances that we've seen in countries and how they dealt with the pandemic. And we have with us Dr. Mariam Matar, who I'm very delighted to have with us as well, and who can, share with us a little bit, Dr. Mariam, on how we've seen countries like UAE developing, policies to deal with the crisis and how they have, looked at it from a UAE lens and potentially above UAE, perspective. And what are the lessons that we can learn from how UAE, manage the crisis? If you want to share some of your thoughts about this.
Yeah, Bismillah ar-Rahman ar-Rahim. Good afternoon, everyone. I'm so happy to be here among all of you and to discuss further a situation where everybody is talking about and living it with a second. And allow me, Dr. Aula, I will not talk specifically about United Arab Emirates, and I won't be able to mention some official number as we have a very well-defined authority who takes care of everything related to Corona, which is the National Emergency Crisis and Disaster Management Authority. So again, from a public health point of view, when it comes to United Arab Emirates, I don't think the situation would be so much different. But what makes United Arab Emirates, let's say, come in the front line when it comes to the crisis management, is you can see specifically, I'll talk about the private and public partnership. And that was very clear in United Arab Emirates. And allow me to go back in September 2019, and specifically in our capital, Abu Dhabi. And at that time, there were a very big conference where we are talking about disaster management and crisis management. And you cannot imagine that my colleague and my lovely brother and sister in this well-recognized authority of crisis, they were discussing a scenario of what might happen as, let's say, pandemic, and specifically in relation to a very big event we're supposed to host in 2020, which is Expo. So that itself pushed us to stand on our toes and think about what might be a war scenario happening in our lovely country, God forbidden. And it came with Corona crisis. So instead of having a mock, we went through a very tough, real exercise to express and implement a plan which was in place. And that itself clearly indicates the vision of our leader in United Arab Emirates. And when we talk about United Arab Emirates, we are not talking only about Emiratis. We are talking about more than 200 nationalities who is helping us in build our country and going forward to reach the Mars, as it is one of our mission in United Arab Emirates. So while the crisis is unfold and the emergency measures are in place, we all were able to visualize the effective role of women in the front line. And here it's valuable to mention that all what we've seen today with a women participation in the first line, it was not planned within a moment. It took a history of 50 years for our leader to build the whole community. So, and the message which we learned that we need to prepare, and the preparation needs time, and the time needs a plan, and the plan needs a very clear vision. And that was very well visualized with all the impact and the result of how United Arab Emirates dealt with that. And I believe it's very essential as well to mention the very effective private-public partnership. What we've seen in United Arab Emirates when it's come to coronavirus crisis specifically, we saw that the health sectors, you cannot define them as a public or private. You can define them on a 3 level as a response to COVID. If it is acute case or a carrier with a stable symptoms and signs, or a big community where you need to screen and identify the positive case, quarantine them, and by this, we were able to work collectively as a one unity. And I believe that itself bring to us and give further evidence how essential it's to have a very well-defined structure in regards to responsibilities and role of the private and public when it's come to pandemic. And I believe one of the lessons which was resonating very well in all the community in the private and public healthcare services is the policy which was in place before the crisis. And that again goes back to a planning. So sometimes it's very essential and advisable to think about the worst scenario and think about the dark days. So for such events, you will be ready for that. And when we talk about the front line, allow me to say, simply we are talking about females. As you know, 70% of the front line are females. I'm not talking only about physician, nurse, even the administrative in my lovely country, majority were a female. And I believe that itself clearly defines the male in my country. We have a real gentleman who believed in the role of the woman. And from the beginning, 30 years ago, 40 years ago, they believe in this woman and they give her all her rights, all the valuable education for her to be effectively involved in this front line. So when I talk about the female in United Arab Emirates, I simply talk about a real gentleman who we are living with and giving all this support to the female. And I will not forget here the teachers who were teaching our children and at the same time taking care of them, their own children, their own house. And that itself had a huge impact on their psychological status. And by the end of the day, with our extending family, again, the women in UAE, which I usually repeat, we are not better than any women in any other part of the world, but simply we are very lucky with many other situations which we are surrounded with. And specifically when it comes to psychological support, the extended family were of a great support for the woman who was in the front line. So even if she's in the hospital, even if she's teaching, she has her mother-in-law taking care of her children. She has a very honest nanny who's taking care of her children as well. So here we have to emphasize on how important it is for any community where the female are in the front line to have a very good, well-defined safety net for them when it's come to psychological support, economic support. And I would like to finalize with a specific point again, is related to United Arab Emirates. Maybe people will say you talk a lot about your country. I think I have all the right to talk about my country, and we have no right to talk about other countries. And during COVID-19, it clearly shows the reality which we see in our genetics. There is no one size for all. There is no one policy which should be approved by WHO, which should be implemented in all nations. This is a very strong lesson for all the decision makers. We need to make sure to define policy as per the needs and the situation of each country and each region. Previously, WHO were always having this approach where we define countries according to the region. And I believe things should be thought again about, and the whole system of the approach of policy, which should be emphasized by a global organization, should be reformed and planned as per the need of the country, not only the region. And that was very clear even in the response of the people, where we knew that genetics and the ethnicity of each population has a huge impact in response, and how well defined is the healthcare service and how well prepared it is. And that itself also emphasized finally on another point. We have to have not only a plan for food security. We have to have a plan for job security or diverse job needs security. At the United Arab Emirates, we very well appreciate and understand the role of non-Emirati in helping us to build our country. And in the same time, however, it's very essential for us as an Emirati at least to have our own secure part of our community, where our own nation will be able to take the lead throughout the chain of the response, not only during emergency and even the other type of crisis which we'll be in. So in conclusion, the lesson to be learned, it's very important to put in mind history and time. Use the time to develop your own people with their education, with their knowledge, where they will be able to effectively involve in any other plan, to have a visionary leader who put a plan for the worst scenario to come. And I think that was very clear in United Arab Emirates. And again, to appreciate and make sure that there is a very well-defined structure between the roles and responsibility of the government and private when it comes to a crisis management. And as a woman, if you talk about any crisis, I think you are simply talking about women, especially in the front line. And we look forward to have a robust, well-defined, redefined of WHO policies and procedure, and especially the approach to be defined according to the needs of the countries rather than the region or ethnicity or even gender equity. And finally, I would like to emphasize on the gender equity. Women in this part of the world and any other part of the world, she were suffering enough with many challenges, which really bringing the gender equity in as a very hot subject to be discussed on policy level. And now with the crisis, unfortunately, these challenges became huge enough to emphasize the need of redefining United Nations this time, the rules and policy and procedure when it's come not only in healthcare as well as managing other human needs in any part of the world, considering ethnicity as well as gender identity.
Yeah, thank you. Thank you very much, Dr. Mariam, for sharing your perspective, sharing the experience of UAE. I think to me, there are a couple of key takeaways that I keep in mind, from what you mentioned. But it is true that we've seen it across the globe, the importance of preparing for the pandemic versus dealing with the crisis when it happened. And I think that's definitely something that's made a difference in the ability of many countries to react quickly to the pandemic. And I think, as Dr. Fadi mentioned, we are looking at this pandemic from an optimistic lens, but I think it's also a great opportunity for all countries to be ready for whatever a potential wave 2 or other pandemic. So this is definitely one key takeaway that I took from your talk. The second one, was I would say how lucky Emirati women are from what you shared with us today. Not only to have empowerment by the system and leaders, but the family support is definitely something that we've seen missing and being a challenge, not because it's absent in many of the countries, but mainly because of the way societies are structured and the challenges that younger people had to reach their grandparents and avoid the risk of infection. So definitely how the society lives together makes a big difference if we compare it to maybe, societies that live together, closer, big family versus other societies. You have mentioned also the importance of public-private partnership, and I wanted to build on this because of the importance of a clear research strategy that needs to be in place by, the academia world, as we heard from Dr. Fadi, by governments, but also by private, because as we've heard it, before, this is a big magnitude of a pandemic and a crisis that needs everyone, to join forces. And we will come back to the point of Dr. Fadi, which is regional collaboration later on. But I wanted to pick on that dimension on the public-private partnership and taking, advantage of having with us Dr. Graciela today, who represents one, actor from the private sector represented by the pharma industry. And there is a lot of hope, I would say, that is driven by the research world in general, and where we see pharma playing a critical role in the race for treatment and for vaccine. And I think to you, Graciela, can you share with us, a little bit about how you've seen innovators in general and Pfizer in particular contributing to this drive to develop a vaccine, for COVID? Where do we stand? And what are the key actions that we've seen pharma take? And maybe you can pick Pfizer as an example in accelerating a solution for the pandemic via vaccine or treatment.
Thank you. Good morning from Costa Rica, and good afternoon to you and all the audience joining this panel. First, thank you for the invitation. I feel honored to be part of this panel invited by the Arab International Women Forum. I joined this session with Dr. Mariam and Dr. Fadi, and I can be more than agree with all the positioning they have been doing at the beginning related to the impact that this pandemic has been representing to the world, and mainly in the women's sector, which is, as we mentioned, more than 70% participating in this fight. So I think that is very important, excuse me, to talk about this topic. The coronavirus pandemic is impacting our lives in many forms, at many levels, from the most individual, personal aspect to society scenario and economic countries, and as Dr. Fadi mentioned. We all are familiar with the evolution of this pandemic, and many organizations like WHO, the health authorities, government, and the pharma industry, the pharma sector where I belong, have been following this very close. I think it's important to put in context that we are now arriving to the 7 months of this pandemic. So we have been practically all the 2020 in this scenario. this has been started in December 31 in China. 8 days later, the pathogen was identified as a novel coronavirus. By end of January, it was considered a public health emergency, and in March 11, it was upgraded from epidemic to a pandemic category, with relevant impact in burden of disease and mortality. Worldwide, we are now close to 12 million cases, and unfortunately, more than 500,000 deaths. And we have learned how to live and adapt in this scenario. As Dr. Fadi and Dr. Marian mentioned, we need to adapt to this new reality, adopting special measures, social distancing, working from home, schooling at home from kids, challenging times, but also, as you mentioned, times where resilience, solidarity, and innovation have been more present than ever. And we understand in all these new contacts the impact that this represents to the female sector, female that is wife, that is parent, that is mother, that is working in the front line also. And we need to adapt in this context with this solidarity network that Dr. Marian mentioned to be able to build the best solution in the best short time possible. Precisely in terms of innovation, I would like to reflect on the Pfizer agenda in the context of this COVID-19 pandemic. At Pfizer, we have the purpose to develop breakthroughs that change people's lives. And in the face of COVID-19, I think this call is more urgent than ever. And we have been working since day one to address this crisis, focused in many fronts. Pfizer initially launched the 5-point plan. This is a multi-pronged approach that recognizes that the best path forward is to bring together resources and know-how from all members of the innovation ecosystem. And this is relevant. I think that this has been a key learning that we need to work together and integrate all the sector, because all the sector has a big contribution to do. And as we find this synergetic way to work, we can bring the solution faster. And that was the first initiative of Pfizer, was to build the collective advantage of all the sectors. At the same time, we are focused in the safety and care of all our colleagues. We are working also in securing our production capacity to maintain the global supply to our medicines to patients, because we need to continue securing that all those patients that are in need of any treatment will have the opportunity to receive it, even in the context of this pandemic. We are also collaborating with resources of immediate need to face the pandemic in many countries, and also looking for therapeutic and preventable solutions. In terms of the preventable solutions, we understand that vaccines are the only long-term solution for ending this pandemic. And that is why, in collaboration with BioNTech, Pfizer is working very close with regulatory authorities to develop, to test, and manufacture a potential vaccine that, if approved, could become a preventable solution for COVID-19. We are working in a vaccine with the technology of messenger RNA. It's very innovative technology that works only with the viral genetic information. We don't use any live portion of the virus to create the vaccine. So the vaccine used in this platform are very promising because of their potential for rapid development. So we are running the studies in sites in Europe, in US. We are testing 4 vaccines candidates simultaneously to increase our chance of success and give us the best opportunity to find an effective vaccine with the highest safety profile possible and in the shortest time possible. So that is the level of commitment that this sector is also bringing in looking for the solution. And we have the good news that last week we announced the early positive data from one of these candidate vaccines. And overall, the preliminary data is encouraging. So the data demonstrate that this candidate vaccine was well tolerated and generated immune response. So we feel hope. We are encouraged by this result, and we continue working in preparation to analyze all the data and be ready to bring the solution as soon as possible, because we understand that we are here in a race against the virus. And we need to work and as fast as possible to identify these potential solutions. So our expectation is to analyze all the data of the vaccine candidate, but however, at this point we can say that there is available candidate vaccine based on the immunogenicity and the early tolerability safety data we have.
Well, thank you, Graciela. I need to recognize that I have, a conflict of interest being Pfizer myself. So, I think building on the excitement that you spoke about, and not only from the excitement that we see in Pfizer, but also being, a mother, daughter myself. This is a solution that the entire world is looking forward to, and we know that Pfizer is well on track, and as a vaccine powerhouse at the global level, we're excited about the momentum. But I wanted really to go to one of the common themes that I heard through all the speakers, which is the importance of collaboration, right? And I'm sure we'll get some questions, I'm sure. But can you tell us, how is the pharma, and maybe speaking about Pfizer in particular that you represent today, how do you see the collaboration happening at the global level, but also bringing it to the country reality, to ensure that countries have also access to this, solution as soon as they have plans for their needs. So can you tell us a bit how you've seen, pharma and Pfizer collaborating at a global scale to get ready, and also at the country level to accelerate the access to the vaccine?
Yeah, thank you. Absolutely. I think that this pandemic brings big challenge, but also bring big opportunities to find different ways to work. And the pharma industry sector has been working since day one, working together. Pfizer take the initiative to launch this 5-point plan, and some of these points were related to collaborative network, to create platforms where all the scientists, the experts, can share in a platform when they can share how the progress of the studies are running. All the ecosystem of research and development is working very close, is working in unprecedented speed. We are practically 6 months after the pandemic. We are now presenting the first data of one of our vaccine candidates. That is an evidence how all the sectors are working to accelerate a solution. The regulatory agencies are giving priority. We are exchanging in parallel time all the evidence we are collecting. We are creating platforms where all the companies are supporting. Pfizer, in this 5-point plan, for example, one of the offer was to put all the manufacturing capacity at the disposition of any promising therapy, because the race here is against the virus. We understand that we need to find a global solution. The demand will be enormous because this is a pandemic with worldwide impact, and we know that not only one company will be able to bring the solution the world needs. So, and in that context, all the pharma industry, WHO, some foundations are working together, creating some ecosystem where we can share and accelerate and find a way to put the vaccine when it's ready as soon as possible in the country. So I think that this pandemic brings also opportunity for the new reality as we introduce this panel. Because in the new reality, we also need to start working from now for future threats. We are all facing a coronavirus pandemic, but we can have the same situation in the future, and we need to be prepared from now. And this is one of the 5 points that Pfizer put also in the context to start creating some synergistic working group with all the sector to be prepared for future threats. And I think that are part of the good learning that we are identifying in this sector and this collaboration. And for my perspective also is that this should be translated at the different areas. We should be creating balanced and collaborative family environment where all the members of the family can collaborate together. We can make our personal contribution also keeping safe ourselves, protecting the most vulnerable people in the community, and contributing in country following the right health public recommendations. So I think that we all, from a personal, individual to community, in the family, we all have something to do and something to contribute to diminish the impact of this pandemic. And the pharma and the innovative sector and the private sector is clear that we have a big role to play, and we are working since day one, 24/7, focus on that.
No, thank you, Graciela. I think it's extremely encouraging to hear all the research projects where they stand when it comes to, finding a vaccine and bringing some hope to see some light at the end of the tunnel. And just like you mentioned, I think pharma has a big role to play in that field, along with the academy and government. So thank you for all the comments. I realize, the great discussions, have brought very important points, and I would like to open the floor for questions. I have the panel here that I will be, checking on the questions. So I will welcome all the questions. If the participants would like to ask a question, I will invite them to use the Q&A section at the bottom right of the WebEx, and I will be taking the questions to the panelists. And
Dr. Ali, can I have just briefly
Sure.
2 points? I wanna just to reflect
Absolutely.
on, and really very, very briefly, the issue about public-private partnership, and now we're actually studying doing a comprehensive political economy, more of an analysis to see how countries responded and why they responded differently. But I tell you that public-private partnership, in fact, in many countries, we've realized that, in fact, countries were using the term public-private partnership, but in reality, at the time of crisis, this concept broke down. There was a lot of dysfunctions in the public and private partnership. Of course, there were some successes in some of the countries, but we realized in many countries that this relationship was mostly contractual relationship between public and private. But, a partnership meaning I share benefit and I share risk. And we've seen in some countries the private sector opted out and tried to keep the public sector dealing with the implication of corona because of economic benefit. So I think we need to qualify that, because there is a lot of successes, but also we have some failures in terms of framework. In fact, what we are calling is to have to revisit the framework for public-private partnership in countries, and to have a better regulation, particularly in low middle-income countries. The other point about vaccine, I understand the investment that's being done now. But again, I want to go back, I'm a policy guy, so I go back from a government perspective. We have, over the last 2 decades, 5 major outbreaks: Zika, H1N1. We have many. So, but at the same time, Ebola vaccine development came late because this is because of the market-based approach to investment in vaccines. And we all know that the private sector invests in a vaccine when we have a predictable market that is profitable. And this is very legitimate. But what is missing is the role of government. What the government is doing to actually change, modify the incentive for the R&D model for research and development, so the pharma industry can better be much more proactive and investing in vaccine before we are now at a crisis, but still we lack vaccine. But we haven't learned a lot from what we can do over the last 2 decades, because there was clear picture that if we get into a pandemic, we will have a problem with vaccine. So I appreciate all the efforts being done, but there's something missing from government, and government should have been actually much more proactive to work with the private sector, with the pharma industry, and to actually create some much more incentive and push and pull incentive, I would say, in order to have a better investment. I just wanted to clarify those 2 points, and this is my point of view.
Sure. No, thank you. Thank you very much, Dr. Fadi. These are very critical points, and I will, ask the panelists to comment on some of the points, and I will comment as well. Dr. Mariam, I see you wanted to comment. Go ahead.
Yes, I would like to add to complement what Dr. Fadi said just now. When it's come to the vaccine itself, I believe, again, we need to redefine the whole partnership as well, not only with pharma company, as well as with academia. I think this pandemic clearly defined the huge gap between academia and clinician and clinic field, where we've seen many of those academic initiatives where they have so advanced achievement when it's come to clinical trial. But again, when it's come to clinical application in phase 2 and phase 3, here where the whole tunnel gets blocked and the whole process of the vaccine to go forward get delayed. And that was clear in the previous outbreak of SARS and Ebola. So things were very successful when it comes to the academia and applying the whole process of research and discovering a new vaccine. But the biggest challenge was funding of these clinical trials. So I think with Corona, we learned the lesson, but we learned it in a very hard way. And I think what happened in SARS, it won't be repeated in COVID-19. And this is a lesson forward where I think we need to close the tie between academia, clinician, and pharmaceutical companies. And unfortunately, for the past, let's say, 3 decades, the academia were isolated in one corner, the clinician in one corner, and the pharma used to bring us together. I think this is the time where we realize how essential to have this complete chain of continuity of support and service, and people talk together. And when it comes to vaccine, I believe also we have to bring in our mind and think about the huge advance in molecular biology, which was not existing for the past, let's say, only in the past 5 years. We saw the huge improvement and development in molecular biology when it's come to equipment, technology, software, big data analysis. It was so much well-defined and developed, where empowered us with this excellent tool to come up with whatever achievement we as a human celebrating today, when this vaccine will come in reality and people will be able to have a better quality of life and enjoying their life back. I don't think anything will go back to normal after Corona. But again, academia, clinician, pharmaceutical companies, and the whole chain to be connected very well in a very defined area, and the budget shouldn't be any struggling. And I believe I agree with Dr. Fadi, here the government should come forward. And finally, I think I forgot a very essential part of the whole frontline team. And again, I'm talking from a local point of view in United Arab Emirates. And I clearly agree with Dr. Fadi. What happened in United Arab Emirates, it is not a one case in other countries. I believe we need to remind ourselves with a huge, great impact of the role of volunteers. Volunteers from all the fields, they were with us in the front line. And that itself what brings all the solidarity within the UAE community. And I think it's clear for everybody. You can hear in the news how United Arab Emirates always try to remind ourselves, we in United Arab Emirates try to remind ourselves with a value which was embedded and rooted with us from His Highness Sheikh Zayed, Allah yarhamah. We made sure that whatever support and emergency measure we put in United Arab Emirates, we will not forget our neighbor and we will not forget those countries who need that help. And I believe everybody heard how United Nations and WHO emphasize on that role of United Arab Emirates to show solidarity to other neighbor country or in need country. That's the point which I would like to emphasize on and close my comments.
Thank you, Dr. Mariam. Graciela, do you want to comment on the research strategy of the pharma and the balance between research and development, and maybe the effort that countries we have to consider in what we call the knowledge-based economy and where we stand in terms of infrastructure to facilitate the clinical trials being developed. So do you want to touch on that point?
Yeah, thank you. I think that this is a very relevant aspect, and I agree that we can work inclusive, more aligned, and more connected among the sectors, and that this context of the pandemic bring big opportunity and learning lessons for the future. Particularly, Pfizer has been working for many years in the vaccine area and working with different models to secure access to the different sectors, to the different countries, and creating mechanisms to accelerate the vaccine worldwide. So I think that we have a great experience like the Gavi initiative, where our vaccine has been contributing in many countries that need the vaccine and need also some access mechanisms. So Pfizer has been focused on that. And I think that we mentioned that we are in a race against the virus, right? This has been challenging time, but it's evident also that the world is more prepared than ever to face this with the advance of science, technology, and innovation. And we know that these advances in science, technology, and innovation need to be also accessible in an equitable way. So this has been also an opportunity to recognize the collective advantage of all sectors, working together, the academia, the private sector, the government, all the institutions, the foundations, working together and sharing knowledge among the sector. We are confident that in this context, the science will win, but agree that we can continue working in better scenario after COVID, and Pfizer is already setting the baseline to be prepared in the future for this networking and this collaboration model. We are creating this preparation dynamic with some foundations, some organizations, where we are expecting that many companies will join, and we are already discussing how we will be prepared in the future for some scenario like we are facing right now, because as Dr. Mariam mentioned, we don't need to wait for the crisis. Now we have the learning lesson in that aspect. So I think that is important coming to the future now.
Thank you. Thank you very much, Graciela. Thank you, Dr. Matar. Thank you, Dr. Fadi, for the great discussions. I think for me, I'm leaving this great discussion with a couple of key takeaways. That would be that women have been in the forefront of COVID crisis, and they need to be in the middle of the pandemic plans that are being developed, because we see that they take the hit as frontline workers, and we cannot ignore the pledge that AIWF has started the meeting with, which is whenever there are recovery plans and plans to recovery put in place, we need to look at them through the gender lens, considering the differences between men and women in dealing with the crisis and the role they play. The second one that was critical was the importance of, a global approach to the pandemic, a localization of the approach, considering the specificity of the countries. I think we heard it very clearly from you, Dr. Fadi, and from you, Mariam as well, Dr. Mariam as well, and the importance of thinking, now that we've been through the crisis, on a regional, global approach to join forces on it as well. And to me, being from this part of the world, but also, working for a global company, the importance of, thinking ahead. I think we heard it a couple of times, and the government's, role in the future to build the infrastructure that will enable, like a homegrown, research that will be continued over time to be prepared for this time of pandemic. And I'm leaving with the note of hope shared by Dr. Graciela that there is light at the end of the tunnel from multiple, research bodies. And we heard the case of Pfizer, that we should have a vaccine, developed hopefully soon to come to an end to this pandemic and have the tools to deal with future pandemic and the learning from it. So with that, I really want to thank all the participants. Thank you again, Dr. Fadi, for the brilliant intervention, Dr. Mariam, for all the comments, and Dr. Graciela for sharing the pharma perspective. Thank you very much, everyone. Have a great rest of the day. Thank you.
Thank you. Thank you. Bye-bye.
Bye. Bye. Bye-bye.